Great presentation, Jennifer, looking at unique challenges that you have due to the geographical layout, weather-wise, and the remote location, and how you're putting together solutions through standardization of equipment and working with in-house biomedical engineering services. We know our good friend Kevin Taylor there, and I know that he is part of this success. Next, I would like to move to our Professor Malcolm Sperrin. Dr. Sperrin is the Director of Medical Physics at the National Health Services at Swindon, England, in the UK. I noticed that he is alumni of the University of Reading, and I wonder if that's the same railroad station card that I see on the Monopoly game called
It
Reading.
is. It absolutely is, yes. Well spotted, gosh.
So now I have a story to tell. Great.
Yeah, marvelous. Yes.
I'm looking forward to bring our collaboration and scheme for improvement with partner with this presentation about medical physics and clinical engineering. And because Professor Sperrin is so familiar with our field, clinical engineering, this is going to be an exciting presentation, and I'm looking forward to listen to that. Malcolm, please.
Thank you very much, sir. Thank you. So if we can just move on to the next slide, please. So where I work now is at the John Radcliffe Hospital in Oxford, but I've got a much broader role which works for clinical engineering in the whole of the UK and also into Europe and to a lesser extent around the world. So just to focus on where I work and how we're organised, that's the purpose of this particular slide. So we are a very large centre. You may have heard of Oxford. It is one of the two centres of clinical excellence outside of London in the UK. So it's a very large centre, and we have a very diverse range of services, whether it's from acute medicine, chronic medicine, therapies and so on. And we provide, in addition to the core services that we've been talking about so far, a lot of academic support. So whether or not that's to academic projects or whether or not it's to developments, innovations, or to investigate data and results and so on. So that's a key part of what we do. But we also have a very large outreach program. So if anybody wants to collaborate or gain assistance or insight or just to discuss what they're doing, then it's our pleasure to be able to help. So for instance, in Portugal, there was one university there who is doing a lot of work on biomaterials, which we are particularly interested in, and 3D printing of biomaterials, which is a very new and developing area. So we're very keen on that. We're also a specialist provider of some highly unusual services. So this may be the generation of very new techniques for radiotherapy or the delivery of new types of drug, which may be limited in how they can be used and so on. So my department then is medical physics and clinical engineering, and that uses, or that includes 7 major areas, and you can see those on the right hand side. So all of those are fairly obvious. Physiological measurement I'll talk about in just a moment. Next slide, please. So how this actually works in the UK, we've got certain subtle differences with regard to how we work and how they may be different from other territories. But my department does a lot of work on device management. So this isn't just making sure things work, but how that can also be improved. And likewise, device repair. And that's quite a difficult area because some of the repairs may be on devices for which there is no modern equivalent. So spares might be a problem. There's always a temptation to buy another piece of equipment, which may be good, but if a clinician is operating in a very small specialist area, what you don't want to do is to drop in new equipment that they may not be so familiar with. And then we look at asset management and purchasing advice on what fits in best with the clinical intention, but also with the aims and ambitions of the hospital and the health economy. and likewise with legislation and guidance. So this becomes very, very complex and has become really quite a severe problem in how we manage our response to COVID. So for instance, we, as has already been described in the United States, in the United Kingdom, we brought in a large number of ventilators from around the world, but they didn't always follow the same guidance which we would have in the UK. That's not to say that anyone is better than the other, they are just different. So we need to put a lot of time, and had to put a lot of time into managing that difference. And then we provide support to national interests, so assisting with the UK and international response to COVID, what we can, what we can't do, how we minimise the spread and so on. We provide state level expertise. So the UK government was asking what type of intensive care units we should be setting up for our response hospitals, and furthermore worldwide collaboration, in particular for areas where there's a very urgent need for intervention through what we call non-governmental organisations. So you can see some of those on the right hand side there. So that might be clearly the Red Cross, but I think also the Médecins Sans Frontières and so on. So all really important. And also research. I'm very enthusiastic about research. Next slide, please. So let me illustrate some of the points that I've made by way of example. So there's a map of central London, and we had these hospitals which were set up around the UK, and the largest of which was in the East End of London in an arena. So this would normally be used for exhibitions. And you can see a picture of that on the right hand side. And there would be 4,000 beds in there, potentially 4,000 beds. And each one of those had to have its own ventilators, oxygen supply, its whole range of equipment, both for that bed and also spare equipment should some of that equipment start to break. Because remember that these hospitals in this form didn't exist previously, so we're very much in an unknown area here. We didn't know how resilient this system was going to be, and that continues to be the case. And then oxygen. There's always an assumption, so the central slide, the central picture in this is that the oxygen towers, what do we actually do with how we provide oxygen? Now this could be what in the UK we call an estates asset. It's the fabric of the building, and we have specialists working on that. But gas flow in particular, where you're getting a greater distance between a supply of the gas and the user, that is very much a clinical engineering problem. So the collaboration between experts in different, rather diverse specialist applications becomes of crucial importance here. And on the left, you can see one of the response carts which we use for supporting patients. So next slide, please. Another example is extremely complex. So the picture you're seeing there in blue is a LINAC, a linear accelerator. But we, insofar as we can, we tend to try and repair these when they go wrong using our own clinical engineers. Now, it's a different LINAC, but nevertheless, on the right-hand side, you can see just how complex these devices are. And there's hundreds of parts that can go wrong, all of which will affect the functionality and reliability, and more importantly, the safety of that device. And the two broad areas here, one is that on the bottom left, you can see what looks like an X-ray with some colouring in it. That is the prediction of those radiation fields for radiation therapy. If those clinical engineers get that device incorrect, that will be delivered in the wrong place. So there's a key interplay, a key collaboration between the clinical engineers, the radiographers, the doctors, the medical physicists, the dosimetrists, the range of skills that come together to make sure that this is provided in a safe and effective manner and reproducible manner. That's very, very important, is running into maybe 10 or 15 different professions. And part of my job is to make sure that they all work together effectively. And in the middle, we can see there is a need to make sure that the radiation that's delivered is safe, not just for the patient, but also the staff and the surrounding population and attendant relatives and so on. So radiation protection is also crucially important. So that's another profession, a highly specialist profession that comes into play. Next slide, please. Physiological measurements. So this is one of my own personal professional interests, and that we've only just begun to measure what can be measured, or what we would like to measure about the human body. And we all know about in the very simplest sense, we can measure size and height, but how accurately do we want to measure those, to a millimeter, to a centimeter, and so on? That's fairly well established. But also heart rate and blood pressure, we think that's fairly well understood. In actual fact, it probably isn't, in particular in relation to disease. And for heart rate and blood pressure measured, not when you're just static, but also when the patient might be walking around. So what's called the ambulatory physiological measurement is very important. And we can have a very long list. And at the bottom of this, we've got the ability to measure things like the psychology of the patient and some aspects of psychiatry. And that list can be very long, very, very long. And I personally think that's where we are heading. That's why we need a multitude of different scientific disciplines and clinical disciplines and nursing disciplines all coming together with a consolidated effort. I'm extremely keen on that. Next slide, please. So obviously COVID is very important at the moment. That's going to be in our minds, certainly for now, and as a critical issue, as an acute issue for the next 6 months, and as a declining acute issue probably for the next 12 months. But COVID is always going to be with us. So we have worked with various government organisations to make sure that the COVID response that we are competent to deliver in a hospital is extended out into the community, but not just the community around us, but the much broader community. And there are skills which wouldn't normally be available to the state, to the government. So they tend to rely on the skills which are embedded within the hospital, such as for my department. So we will make sure that we have a facility that enables a mobile laboratory. That's really what this is. That's what you're seeing here. This isn't the one that we used at the moment. I didn't really want to put the latest pictures up. But this is a mobile laboratory, so we can take the testing facility to where a particular sudden increase in COVID actually is, so we can respond and adapt very quickly. And this uses the skills certainly of the clinical engineers to make sure it all works, but it also includes cybersecurity, because these are patient details. It also includes the immunology, virology, genetics, medical physics, and so on. And the number of skills which we've used to try and get these mobile units together is running into 20, 30, 40 different disciplines. So that's a very good example about where we can actually extend our role and to provide additional, really quite significant benefits. So not just to the patients, but also the ability of the state and the health boards to respond. Next slide, please. So from my point of view, the areas to focus on, and I would invite anybody who has an interest, either by way of just discussing this, or if they would like to collaborate or to form a more substantial document. So the 6 key areas. One is the precision and accuracy of what we do. So that's really quite difficult. That's measurement science. That's quite difficult. But there's also a key one which I'm very, very enthusiastic about, is that's interstate collaboration. So the virus, COVID is a good example, does not respect boundaries. And we have seen in particular in Central Europe, where some countries have requested other countries to actually take on some of their COVID patients. So that degree of collaboration is of vital importance, but of course it does mean that we've all got to speak the same scientific language. We've all got to make sure that a patient who's being transferred has the ability to be managed in the same way, whether they're in Spain or in France. Artificial intelligence, I don't need to speak to people of your capability what that is, but that is of importance at the moment, but is likely within the next 10 years to be of absolutely crucial importance. And likewise with networking and IT. Support to disaster relief, there's a lot we could do with this. We tend to have most of our clinical devices running on mains voltage. But we in Oxford are very keen on trying to find ways in which those key devices, which will be of immediate response benefit to Médecins Sans Frontières, etc., where they could be deployed, even using solar power and so on. And innovations are very key. key important. Next slide, please. So there's my details. This is my last slide. So just to talk about myself here a little bit, because I would be the way in which you get contact. So we provide the professional support. So we look at the competencies of staff, we look at how you actually assess that competence, and the ongoing guidance to make sure that both individuals are working as well as they can, but also whole services are as good as they can be. So we provide the academic support. So we teach a number of the Royal Colleges, and we teach around the world to make sure that the standards are maintained. And research. So I've mentioned already what my key interests are here, and there they are again. So research and capacity building. That's one aspect of the sciences and clinical engineering and medical physics that's often overlooked, is how we build the capacity to develop services further forward. Money is clearly a problem, but if you've got the intent there, and if the benefit is clear, then the capacity can follow. And that naturally leads on to the fifth point here about the resilience and contingency. And that's one area that is usually forgotten about, but that's becoming more important. You can see how important that's been, developing skills, developing resilience after COVID. COVID is here to stay, and the only thing that's certain is that there's going to be another challenge to us as healthcare professionals. So I at the hospital manage 750 scientists, so these are at every level from professors all the way down to trainees. And I manage their activity in 53 different professions. And each one of those has got key skills without which the healthcare facility would not work. And my job is to make sure that they all work together effectively and in a way that means that we are protecting ourselves against the future. So my details are down at the bottom. If anybody does have an interest and would like to open up a conversation, then it would be my pleasure to welcome you, as it would be indeed a visit if you'd like to drop by too. So thank you very much for listening. And I think there's just one more slide to finish the talk off. There we are. Thank you.